The next section of Chapter 28 that we'll cover includes helminths, flukes, tapeworms, and roundworms. So these are the more complex organisms we'll discuss in parasitology. They belong to platyhelminths, or flatworms, which includes flukes and tapeworms, and aschelhelminths, which include roundworms. Helminth infections are caused by flukes, tapeworms, and roundworms. Flukes fall under the class Trematoda, while tapeworms fall under Cestoda and roundworms under Nematoda. As mentioned before, flukes that fall under the class Trematoda are members of the phylum Platyhelminth, and these are also called flatworms. Most infections are seen in people from East Asia, Africa, South America, and some areas of the Caribbean. We'll be discussing each of these flukes listed in the table, and we'll be referring to them by their scientific names, but you also should be familiar with the common names that they're referred to. Humans become infected by directly ingesting eggs, ingesting larvae in an intermediate host, or through penetration of the skin. Fluke infections may be asymptomatic if only a few worms are present, but they will have symptoms if a large number of worms are present. Adult forms of flukes do not multiply in the human body as we've seen in previous parasites such as protozoa or those in the phylum Apicomplexa, so the number of eggs or larvae ingested are directly related to the number of adults present, and this is referred to as the worm burden. Most of these parasites infect the intestinal tract, but some species also can infect the liver, lungs, lymphatics, and blood vessels. So as I've mentioned before in this chapter, the tables are very helpful and a great tool for comparing the different organisms. So table 28.7 shows a comparison of the different fluke eggs. So we'll discuss the similarities and differences in size and features of Fasciola hepatica, Fasciolopsis buski, Paragonimus westermanni, Clinorchis sinensis, and Schistosoma species in the next several slides. So this figure shows the generalized life cycle of the liver, lung, and intestinal flukes. So in all species, the eggs actually must reach water to mature, and all have snail species as the first intermediate host. The myricydium, which is the first stage of larva, is what is ingested by the snail. And this is while it's within the egg, or is then released from the eggs and penetrates the snail. Within the snail, a complex development of germinal tissue occurs, resulting first in sporocysts, then in radii. The cercaria, which is the second stage of larva, develop within the radii and is released into the water. The cercaria then attach to aquatic vegetation, or they can invade flesh of aquatic organisms. This is referred to as metacercaria in this stage, and this is the infective stage for humans. Once the metacercaria are in the fish or seawater organisms, humans ingest the infective stage, and then the life cycle continues. As has been mentioned before, flukes are referred to as trematodes, and they are also more commonly referred to as flatworms. So the first flukes we'll discuss are the intestinal ones, but the various species have intermediate hosts of fish, crabs, or snail depending on the species, with all or most having snail being the first intermediate host, as was seen in the previous slide in the generalized life cycle, and this is the host of which infection is transmitted. Adult flukes typically measure several millimeters to up to 8 centimeters in length, and they've been described as flat and leafy in appearance, and this is how they've gotten their name flatworms. Fasciolopsis buski is known as the giant intestinal fluke, and this is found in the Far East, including China, Vietnam, and India. Dogs and pigs serve as reservoir hosts, and humans acquire the infection by ingesting the metacercaria on freshwater vegetation such as bamboo shoots and water chestnuts. Adults of Fasciolopsis buski live in the duodenum, where they cause mechanical and toxic damage. Inflammation and ulceration of the mucosa may occur, and heavy infections result in persistent diarrhea, anorexia, edema, ascites, nausea, vomiting, and intestinal obstruction. Finding the adult or egg of Fasciolopsis buski is diagnostic, although the egg is more commonly seen. The adult fluke is flattened and measures 2 to 7 centimeters long and lacks a cephalic cone seen in Fasciola hepatica. Adults are usually not seen in stool sample unless it's a purged specimen. Eggs appear yellow to brown and average in size of 130 to 140 micrometers by 80 to 85 micrometers in size, and have a small, relatively inconspicuous operculum. They are unembryonated when they are passed. The eggs of Fasciolopsis buski are actually identical to those of Fasciola hepatica, so when these are observed in microscopic smears, it should be reported as Fasciolopsis buski / Fasciola hepatica eggs, because they can't be identified to the specific species. This image on the right is showing an example of Fasciolopsis buski adult fluke. So this one measures approximately 3 centimeters in length. Of note, there are 2 other intestinal flukes mentioned in the textbook, Metagonomus yokogawai and Heterophes heterophes. So these are 2 small flukes found in the Far East and Middle East, and humans acquire infection by ingesting metacercaria in undercooked or raw fish. Adults live in the small intestines and produce few symptoms. Patients with heavy worm burden may have diarrhea, colic, and loose stools with a large amount of mucus. Adults of both of these species are small, and eggs serve as the primary diagnostic stage. They measure 28 to 30 micrometers long and have a vase or flask-like shape. They're embryonated and operculated with inconspicuous shoulders at the operculum, so the eggs of these species resemble Clinorchis sinensis, which we'll review later on. So here's an example of a Fasciolopsis buski Fasciola hepatica egg. So this is an unstained egg on a wet mount. So you can see it appears yellow to brown in color, and again, it's not stained, so this is not iodine. It's 130 to 140 micrometers by 80 to 85 in size. And then there's a small operculum that's present, and it's a structure that closes over or covers an aperture. So in this image, it's a little hard to see, but right on the top here, this is what the operculum is that you would look for. The smaller image on the right gives an example with more distinct features, showing the operculum and the thin layer of the egg, along with the size. The next type of fluke we'll discuss is the liver fluke. So Fasciola hepatica, as can be inferred by the name, is the liver fluke, and it's known as the sheep liver fluke. It's seen in the major sheep raising areas of the world, including parts of the southwestern United States. It's also been found in some cattle. The organism causes a disease known as liver rot, which is characterized by liver destruction, and humans acquire the infection by ingesting metacercaria on raw water vegetation, especially watercress. The larvae reach the liver by migrating through the intestinal walls and peritoneal cavity. Adults live in the biliary passages and gallbladder. Tissue damage during migration through the liver can result in eosinophilia, an inflammatory reaction, secondary bacterial infection, and fibrosis in the biliary ducts. Heavy infections induce diarrhea, upper right quadrant abdominal pain, hepatomegaly, cirrhosis, and liver obstruction resulting in jaundice. Chronic infections are usually asymptomatic. Adults are approximately 3 centimeters long and have a prominent cephalic cone. The unembryonated operculated eggs are carried in the bile to the intestinal tract and are passed in the feces. The size measures 130 to 150 micrometers by 60 to 90 micrometers, and they're almost indistinguishable from eggs of Phaseolopsis buski, so they're reported as F. buski, F. hepatica eggs, as was mentioned previously. Both the adult or egg observed is diagnostic. So this is the same image from a previous slide showing the egg that would be identified as F. hepatica, F. buski. The Chinese liver fluke, Clinorchus sinensis, is geographically limited to the Far East, where dogs and cats serve as reservoir hosts. The adults live in the distal portion of the bile ducts. Similar to Fasciola hepatica, light infections produce few or no symptoms, but repeated or heavy infection cause inflammation because of the mechanical irritation and result in fever, diarrhea, pain, fibrotic changes, or obstruction of the bile duct. Humans acquire infection by ingesting the metacercaria in raw, undercooked, or pickled fish. The diagnosis is made by finding the egg in stool samples or occasionally in duodenal aspirates. Adult flukes are thin, tapered at both ends, and measure 1 to 2.5 centimeters long. The egg is 29 to 35 micrometers long, and it is embryonated when passed, in contrast to Fasciola hepatica and Phaseolopsis buski, which are both unembryonated when passed. As with the other flukes we've seen so far, observing the adult fluke or eggs present in a sample can be diagnostic. The eggs are ovoid in shape with a thick brown shell, and when passed they can appear flash-shaped and operculated, with prominent shoulders at the operculum and a knob at the opposite end. So this is an image of an unstained wet mount of Clinorchus sinensis. As you can see, the egg does appear flash-shaped, and it's operculated at the top, and it's described as having prominent shoulders, which you can see here coming off the sides of the top of the egg, and a knob that's a little blurry in this image, but can be more distinct in other images of the egg. Paragonymous westermanni is the next fluke we'll discuss, and this is a lung fluke. So up to this point, a lot of the parasites we've discussed have been either involved in the gastrointestinal tract or even urogenital tract. But the primary specimen for identifying this organism is actually a sputum. So the lung fluke is found primarily in Southeast Asia and also in certain areas of Latin America and Africa. Humans acquire infection by ingesting the metacercaria in raw, pickled, or undercooked freshwater crabs or crayfish. The metacercaria exist in the small intestines and then burrows through the duodenal wall into the peritoneal cavity and eventually penetrates the diaphragm and enters the lung. The human host shows few symptoms during this migration, but may exhibit intermittent coughing and chest pain. Major symptoms associated with lung habitation are nonspecific and often include persistent cough, chest pain, and hemoptysis. Adult flukes appear reddish-brown and are approximately 1 centimeter long and live within capsules in the bronchioles. Sputum, as mentioned before, is the primary diagnostic specimen. So eggs are expelled from the capsule into the bronchioles and carried upward in the sputum. Eggs may be found in stool if they have been coughed up and subsequently swallowed. The eggs appear broadly oval, measure 80 to 115 micrometers by 48 to 60 in size, and have a flattened operculum and slight shoulders. They are unembryonated when passed. The shell thickens at the opposite end at the operculum. So this figure shows an example of a Paragonymous westermanni egg, unstained. So it appears broadly oval and has the operculum on one side with the smaller shoulders, and at the opposite end you can see where the shell thickens a little more than it does surrounding the sides of the egg. The next group of flukes we'll discuss are the blood flukes, and these are comprised of Schistosoma species. So the blood flukes differ from other flukes in a few ways. First, they have a both male and female form that exists, whereas other flukes have hermaphroditic forms. A separate male and female exists with Schistosoma species. Secondly, their eggs are unoperculated. With that, humans can be infected by direct cercarial penetration of the skin, in contrast to some of the other flukes we've just discussed, that infection occurs by ingestion of the metacercaria. And the last difference is the shape of the adult fluke, with Schistosoma species being shaped cylindrical rather than the more flattened form of the other flukes. The three primary species of schistosomes we'll discuss that are pathogenic to humans are Schistosoma mansoni, Schistosoma hematobium, and Schistosoma japonicum. As previously mentioned, schistosomes are transmitted when their cercaria penetrates skin from contaminated water. The various species can be found in different parts of the world. For example, Schistosoma mansoni is commonly found in Africa, parts of South America, West Indies, and Puerto Rico, whereas Schistosoma japonicum is commonly found in the Far East, including Japan, China, and the Philippines. The term schistosomiasis is used to describe conditions caused by any of the schistosomes. Symptoms are related to the phase of the fluke's life cycle and location of the adults. Cercarial penetration may cause a self-limiting local dermatitis, including irritation, redness, and rash. Larval migration through the body causes generalized symptoms such as urticaria, fever, and malaise. And the presence of migrating larvae in adults in the veins cause little inflammatory damage, seemingly because they acquire host HLAs and ABO blood group antigens on their surface that then diminish the host's immune response. Chronic infections with schistosomes can lead to various clinical complaints such as diarrhea, ascites, pain, anemia, hypertension, hepatomegaly, and splenomegaly. With schistosoma hematobium, painful urination, hematuria, and dysuria may be present, specifically with this species. So the life cycle of all three schistosomes that are pathogenic to humans is identical. The eggs are embryonated when excreted, and the myricadium is released when the egg reaches water. After sporocytes and then cercaria are produced during a 6-week period, cercaria migrate from the snail into the water, then attach by oral and ventral suckers, and with the help of enzymes penetrate intact human skin. Once in the vascular system, they circulate until they reach the lung or liver, where maturation and pairing of female and male are completed to continue the life cycle. The eggs of the three species have different appearances, so diagnosis can be made by observing them in stool samples with Schistosoma mansoni and japonicum, or in urine, as seen with Schistosoma hematobium. Eggs appear oval-shaped with spines located in distinct positions on each separate species. So Schistosoma mansoni, you can find embryonated eggs in the stool. They appear yellow and oval in shape, measuring 115 to 175 micrometers long by 45 to 75 wide. Schistosoma mansoni has a prominent lateral spine that's clearly visible and no operculum. Schistosoma hematobium differs from the other two species because it is typically found in urine. It measures 110 to 170 micrometers long by 40 to 70 wide and is oval in shape. And again, it's found in urine samples. The spine is located terminally and it's clearly visible, and it also has no operculum. Schistosoma japonicum is found in stool samples and measures 60 to 95 micrometers long by 40 to 60 wide and is oval in shape as well. The spine is small and curved and rudimentary, so it may be difficult to observe. And again, there's no operculum on Schistosoma japonicum eggs. So these figures show each distinct egg for the Schistosoma species. So in figure A, this is a Schistosoma mansoni egg. So it appears yellowish and oval. And this is found in fecal matter. And here we have the prominent lateral spine that's clearly visible. And then as you can see, there's no operculum on the egg. Figure B is an example of Schistosoma hematobium, and this species is found specifically in urine. So here's the terminal spine that was described and is distinct for Schistosoma hematobium. And again, there's no operculum. And then finally in figure C, this is an example of Schistosoma japonicum egg, and it's found in stool. So this egg is oval to almost round shape sometimes, and it's a little smaller than the other Schistosoma eggs. And the Schistosoma japonicum egg also has this small curved rudimentary spine here that's barely visible or may not even be visible. Again, this species is not operculated. So now we'll move away from flukes and flatworms into the intestinal tapeworms or cestodes. So as we saw with the flukes, the species have common names that they're referred to, such as Diphyllobothrium latum being referred to as the fish tapeworm, or Tania saginata, the beef, and Tania solium, the pork tapeworm. So we'll be discussing some of these in a little more detail on the subsequent slides. One thing to note with tapeworms are that they show extensive size variation. So they range anywhere from as little as 3 millimeters to 10 meters in length, which is scary to imagine having a tapeworm that long. But anyway, so again, tapeworms are also called cestodes, and they're in the family Platyhelminths. So the adult forms of tapeworms can or do appear segmented and ribbon-like with a head-like scolex, which is the head-like segment of the tapeworm, and suckers for attachment to the host. The segments are referred to as proglottids, and each proglottid, when matures, produces eggs. Tapeworms are hermaphroditic, so they are self-fertilizing. So this is a general diagram of the tapeworm. So here, as described on the previous slide, you can see first that tapeworms are these ribbon-like organisms whose growth involves addition of segments. So here you have the proglottids and the immature progressing to the more mature. The anterior head-like section is termed the scolex and has parts that serve as a means of attachment. So you have the suckers, the rostrum, and hooklets. The neck is directly behind the scolex, and treatment for infection is typically targeted at detaching the scolex from the mucosa because the neck is where the proglottid production occurs. Gravid proglottids at the distal end of the organism are where the eggs are discharged into the stool. So here again in table 28.8, we have another table showing the comparison of tapeworms. So make sure you look at this and use this as a tool as you're studying this material. So we'll be discussing the identifying features of each tapeworm and its respective eggs on the subsequent slides. So the first tapeworm we'll discuss is the fish tapeworm, Diphyllobothrium latum. So this is one of the species that can measure very long, adults being up to 10 meters long. Humans usually harbor only a single worm, as can be imagined due to its size. And fish-eating mammals in endemic regions can also be infected. So hosts become infected by ingesting larvae in pickled or raw freshwater fish. So this organism is commonly found in the Great Lakes areas. Infections can be asymptomatic, but sometimes nausea, vomiting, and intestinal irritation can occur. Also, hosts can experience vitamin B12 deficiency, leading to megaloblastic anemia. And this is as a result of the organism interfering with the host's absorption of vitamins and minerals from food. So the life cycle of Diphyllobothrium latum is a hybrid between flukes and tapeworms. So the operculated, unembryonated egg is passed in human stool samples and must reach water to mature. The first larva stage, the chorocidium, is ingested by copepods, which are small groups of crustaceans found in nearly every freshwater and saltwater habitat. The organism then develops into a procercoid larva within the copepod. Once the copepod is ingested by fish, the larva leaves the fish intestines, then invades the flesh, where it develops into plerocercoid larva, which consists of a scolex with a thin ribbon-like portion of tissue. Humans then ingest the plerocercoid larva when they eat raw or undercooked fish. The scolex is then released into the human intestines, where it develops into the adult worm. The scolex, proglottid, and egg are diagnostic structures of Diphyllobothrium latum that can be found in stool samples. The egg is usually what's detected. It's unembryonated when passed, operculated, and yellow to brown in color. It measures about 58 to 76 by 40 to 50 micrometers in size and has a small knob-like protrusion. The proglottid is wider than it's long, with a characteristic rosette shape or coiled uterus. The scolex, which is 2 to 3 millimeters long, is elongated and has two sucking grooves, one located on the dorsal surface and the other on the ventral surface. These are two more examples of Diphyllobothrium latum eggs. So again, they're oval in shape, operculated, and yellow to brown in color. In the central image, it's a little hard to see where the egg is operculated and the knob. So here's a different image closer up where you can see on the terminal end is the knob-like structure, and the opposite end there's an operculated area. The next tapeworm species that infect humans are Taenia. So the two species that infect humans are Taenia saginata, also known as the beef tapeworm, which is primarily found in beef-eating countries of the world, and Taenia solium, the pork tapeworm, found in areas of the world with a high consumption of pork, such as Latin America. Both organisms attach to the intestinal mucosa of the small intestines. Symptoms of Taenia infection include vague abdominal pain, indigestion, and loss of appetite. A major complication associated with Taenia solium is cysticercosis, in which parasitic tissue infection occurs by larval cysts of the species. These larval cysts can affect various human tissues, including brain, muscle, or other tissue, and are a major cause of adult-onset seizures in low-income countries. The life cycle of both Taenia species are identical. The embryonated egg is passed in human stool and ingested by an intermediate host. The larval form is freed in the intestinal tract, migrates through the intestinal wall, and gains access by the circulatory system to the muscles of the host. When humans ingest raw or undercooked meat, the scolex then attaches in the human small intestine and matures into the adult tapeworm within 10 weeks. The egg is the most common stage found of Taenia species, and they appear spherical in shape, measuring 30 to 43 micrometers. They appear smooth with thick shells with radial striations in the shell. A 6-hooked oncosphere can be observed, which is the larval form of the parasite within the egg. The eggs of both species are indistinguishable, so if observed, are reported as Taenia species. Whereas the eggs cannot be distinguished to species level, the adult tapeworm can be differentiated based on the number of proglottids and the appearance of the scolex. Taenia saginata has 15 to 20 uterine branches, whereas Taenia solium will only have 7 to 13. The scolex of Taenia saginata is usually less than 5 millimeters long with 4 suckers, whereas Taenia solium has 4 suckers along with 25 to 30 hooklets present. These figures show examples of differentiating features of the Taenia species. So in figure A is an example of a Taenia solium scolex. So note, this species has the 4 large suckers that can be seen here, but then centrally it has the rostellum containing 2 rows of hooks. The image below is the scolex of Taenia saginata. So here you can see the 4 large suckers and the lack of the hooklets centrally on the scolex. The images on the right are examples of the proglottids. On the top is Taenia saginata and a mature proglottid that's been stained with a carmine stain. So note here the number of uterine branches are greater than 12. In contrast to the mature proglottid of Taenia solium on the bottom, in which the primary uterine branches are less than 13. So remember, with Taenia saginata, it usually has 15 to 20 uterine branches, whereas Taenia solium has 7 to 13. And these are important differentiating features of these species of tapeworm. Hymenolepsis species are the next tapeworms we'll discuss, with Hymenoplepsis nana being the dwarf tapeworm, which is found worldwide and is a common one found in children, whereas Hymenoplepsis diminuta is the rat tapeworm and is seen much less frequently. Light infections are usually asymptomatic, but a large worm burden may cause abdominal pain, diarrhea, irritability, and headache. Infection with Hymenoplepsis nana is easily transmitted among children because an intermediate host is not necessarily required. The life cycle is characterized by direct fecal-oral transmission of the egg, development of the sister cercoid in the intestinal tissue of the host, and re-entry into the lumen for development into an adult. This autoinfective cycle is most common, although an insect vector may serve as an intermediate host in an alternative form of the life cycle. The adult Hymenoplepsis nana worm is approximately 40 millimeters long, and it has a small scolex with 4 suckers and a rostrum with spines. The Hymenoplepsis diminuta species measures 20 to 60 centimeters in length, and the scolex has 4 suckers but no hooks. So in both of these images, you're only seeing one side of the scolex, so that's why the 4 suckers are not apparent and you can only see the 2. The Hymenalepsis nana egg measures 30 to 47 micrometers with a grayish color. It has a hollow, lemon-like oncosphere and two polar thickenings from which 4 to 8 polar filaments extend. The H. diminuta egg is 50 to 75 micrometers and can appear gray or straw-colored. It has inconspicuous polar thickenings. It also has a hollow, lemon-like oncosphere, but no polar filaments. This image is an example of a Hymenalepsis nana egg on an iodine wet mount. So here you can see the hollow lemon-like oncosphere, and then there's the two polar thickenings in which 4 to 8 polar filaments extend. The smaller image shows an unstained wet mount. So this one you can see the oncosphere appearance and the polar thickenings and filaments a little better. So note the presence of hooks in the oncosphere and polar filaments within the space between the oncosphere and the outer shell. So this image is an example of an iodine wet mount of Hymenalepsis diminuta egg. So here you can see the difference where the polar thickenings are inconspicuous and the lemon-like oncosphere does not have any polar filaments that can be observed. Dipallidium caninum is the tapeworm of dogs, and humans serve as an accidental host. Children are usually infected by ingesting fleas containing the larval stage, which result in infections that may not cause any symptoms. The proglottid may be seen in human stool samples and is characterized by a pumpkin seed shape and the presence of two genital pores one on each side of the proglottid. But the eggs are characteristically seen, and they're observed in packets of 15 to 25 eggs, each egg measuring 20 to 40 micrometers in size and resembling those of Taenia species. This figure shows an example of the packet of eggs, with individual eggs possibly being mistaken for Taenia species, but the distinct packet helping identify it as D. caninum. Although many of the infections with tapeworms we discussed involve gastrointestinal involvement or presentations, tissue infections can occur with tapeworms. Cysticercosis, sparganonosis, and hydatid cyst disease are the major diseases caused by the tissue stage of a tapeworm, and they originate when a human accidentally becomes the intermediate host. Cysticercosis results when a human ingests the infective eggs of Taenia solium, the pork tapeworm. As mentioned before, this disease is endemic in areas of rural Latin America, Asia, and Africa, and has reemerged as a zoonosis in the United States as a result of immigration of persons from endemic areas. Once the egg is ingested, the embryo is released into the intestines, penetrates the intestinal wall, and enters the circulation to develop a cysticercus in any tissue or organ. The larva can then actually live up to 7 years and elicits a host tissue reaction, resulting in production of a capsule. Once the organism dies and releases larval antigens, there's intense host inflammatory reactions that lead to tissue damage in the area. The most commonly infected sites are the striated muscle, eye, and brain. And symptoms include pain, weakness, and cramps, and other symptoms that may be specific to the tissue that's infected. Sparganosis is a human infection with the plerocercoid larva of a dog or cat tapeworm. Humans acquire the infection by ingesting a copepoid containing the procercoid larva. The disease is most common in Southeast Asia. Diagnosis of sparganosis is made by finding small white ribbon-like organisms with rudimentary scolix. The organism may be removed surgically in the tissue area that's infected. Echinococosis, also more commonly known as hydatid cyst disease, is an infection by Echinococcus granulosus. These eggs are normally found in dog or sheep hosts. The disease is primarily seen in sheep raising areas of the world, including Australia, Southern America, and parts of the southwest US. The adult worm is approximately 5 millimeters long and contains only 3 proglottids. The eggs are found in stool of dogs or other definitive hosts and resemble those of Taenius species. Humans become an intermediate host by accidentally ingesting the eggs. With hydatid cyst disease, leakage of fluid from the cyst, referred to as hydatid sand, causes eosinophilia, and rupture of hydatid cysts as a result of trauma or surgery is dangerous because it can cause anaphylactic shock, a possible allergic reaction, and risk of spreading hydatid sand, which can give rise to new cysts throughout the body. So the image on the right gives an example of juvenile scolix formed from the geminal layer of a hydatid metacestoid, liberated from a hydatid cyst. Next, we'll move on to intestinal roundworms. So human roundworms include those that infect the intestinal tract, blood, and tissue. These organisms are found worldwide and are transmitted by the ingestion of the embryonated egg or by direct penetration of the skin by larvae in the soil. Some may require an insect vector. So first, looking at some of the intestinal roundworms, again we have a table showing the scientific name or the species name and common names associated with them. One you may have heard of is pinworm, Enterobius vermicularis. We'll discuss each of these in a little more detail. So roundworms have 3 morphologic forms: the egg, larva, and adults. And adults exist in separate sexes. Adults obtain nourishment by absorbing nutrients from partly digested intestinal contents or by sucking blood. Patients may be asymptomatic or symptomatic, and the severity of the symptoms is related to the worm burden, as we've seen with some of the other organisms. Severity also depends on the host's nutritional status and age and duration of the infection. Table 28.9 in your textbook compares the diagnostic characteristics of the eggs and larvae of the intestinal roundworms that we'll be discussing further. So the first roundworm we'll look at is pinworm, Enterobius vermicularis. This is a parasite distributed worldwide and is commonly detected in children, especially those from ages 5 to 10 years old. Key risk factors for infection include inadequate personal and community hygiene. Infections are frequently found in families, kindergartens, daycare centers, or crowded conditions in which the eggs can be easily transmitted. Symptoms include anal itchiness, abdominal pain, insomnia, nausea, and vomiting. One of the frequent symptoms of perianal pruritus, which is itchiness in the area, is as a result of the female worm migrating to the perianal area and laying eggs. A laboratory test used to diagnose is the cellophane tape test or the swoop test. Because the eggs are laid outside the body, they're rarely present in stool, so fecal specimens are not satisfactory for diagnosis. The procedure to obtain the eggs should be done as soon as the patient arises in the morning. The perianal area is either touched with the sticky side of the tape or a paddle, and then observed under the microscope to look for the eggs. The life cycle of Enterobius vermicularis is characterized by migration of the female out through the anus at the night to lay eggs in the perianal area, as was mentioned earlier. The eggs are infective with the third stage larva within several hours of being laid. Typically, transmission involves either ingestion or even inhalation of the infective eggs. Direct anal-oral transmission occurs in children as a result of poor hand washing or fingernail biting. Autoinfection, in which the hatched larvae re-enter the intestines to mature into an adult, may also occur. The adult females measure 8 to 13 millimeters long. They have a long pointed tail and a 3-cuticle lip. The less commonly seen male is smaller, measuring 2 to 5 millimeters long with a curved posterior. The egg is oval, colorless, and slightly flattened on one side and measures about 50 to 60 micrometers by 20 to 30. The egg is usually seen embryonated with a C-shaped larva. So here's an example of an Enterobius vermicularis egg on an unstained wet mount. So you can see the C shape of the embryonated egg and the slightly flattened side. Trichuris trichuria is one of the most soil-transmitted helminths, along with some of the hookworms that we'll discuss a little later. These organisms have worldwide distribution and are a major cause of morbidity rather than death in developing areas of the world. Chronic infection caused by Trichuris trichuria, especially hookworms, can adversely affect physical and mental development in children. A heavy worm burden is more likely to result in complications. Patients are asymptomatic when the worm burden is light, but when the burden is higher, patients can experience chronic diarrhea, intestinal bleeding, nausea, vomiting, and abdominal pain, along with possible anemia and rectal prolapse in repeated heavy infections that's been seen in children. Trichuris trichuria eggs are passed in stool and require at least 14 days in warm, moist soil for embryonation to occur. Humans acquire infection by ingesting the infective egg. The larva is released in the small intestine and undergoes several molts before maturing into an adult worm. The egg and occasionally the adult of Trichuris trichuria may be seen in fecal specimens. The adult male measures 30 to 45 millimeters and has a thin anterior and a thick coiled posterior. The female measures 30 to 50 millimeters long with a thin anterior and a thick straight posterior. The egg is brown and barrel-shaped and unembryonated when passed, measuring 50 to 55 micrometers by 22 to 23 in size, with a thick wall and hyaline polar plugs at each end. So here's an example of the Trichuris trichuria egg. So this is a more distinct looking egg. As you can see, the barrel shape and then the polar plugs at either end. Ascaris lumbricoides is a roundworm that's found in tropical and temperate areas, and children are commonly affected. In the United States, this organism is most frequently seen in rural parts of the Southeast. Transmission is primarily by fecal-oral route, and clinical symptoms may be related to the different phases of the life cycle. Infections may be asymptomatic, but heavy infection can impede growth and development in children. Occasionally, bowel obstructions may occur, or a syndrome known as Loeffler's syndrome, which is a form of eosinophilic pulmonary disease characterized by mild respiratory symptoms and peripheral blood eosinophilia. Larva migrans' tissue reactions can also occur as a result of the larva migrating through tissue and causing an immune response. The adult worms can be found in the small intestines. The life cycle of Ascaris lumbricoides takes about 50 days after infection until adults are mature. Eggs that are deposited in warm, moist soil become infected within about 2 weeks. After the egg is ingested, larvae hatch in the duodenum, penetrate the intestinal wall, and gain access to the hepatic portal circulation. They break out from capillaries into the lungs and travel up the bronchial tree and trachea and over the epiglottis and are swallowed. Maturation completes in the intestines. Adult worms measure 15 to 35 centimeters long and about the diameter of a lead pencil and may be seen in stool samples. The usual diagnostic stage is the egg. Fertile Ascaris eggs are oval, measuring 45 to 75 micrometers by 35 to 50, and they have a thick hyaline wall surrounding a one-cell stage embryo. Most eggs have a brown bile-stained mammillated outer layer. Some eggs described as decorticated lack this mammillated outer layer. Infertile eggs up to 90 micrometers in size are often elongated and contain a mass of highly refractile granules and are described as being disorganized in their contents. So the image on the left is showing an example of an unfertilized Ascaris lumbricoides egg. So these eggs are described as being oval in shape, and they appear brown because they're bile stained, and they're described as mammillated, which means they have these bumps all over the surface. The image on the right is an example of a fertile Ascaris lumbricoides egg. So the fertile ones are described as rounder or oval shaped and not as long as the unfertilized ones. And they also have a thick hyaline wall that can be seen surrounding a one-cell stage embryo. They also are described as having this mammillated outer layer. And then finally, this example is of a decorticated fertile egg. So this egg, although fertile, lacks the outer coat that the other two eggs have in these images. Hookworms are the next group that we'll discuss, and these are one of the most common human parasites. It's the second most commonly reported helminth infection in the United States, and close to 1 billion people are estimated to be infected worldwide. Unlike other helminths, in which infection peaks in childhood and adolescence, the hookworm burden often increases with age. Clinical symptoms differ according to the phase of the life cycle and the worm burden. A small red itchy papule referred to as ground itch develops at the site of larval penetration. If large numbers of the larvae are present during the lung phase of migration, the patient may have bronchitis. The most severe symptoms are associated with the adult hookworm, including nonspecific symptoms such as diarrhea, fever, and nausea and vomiting. Chronic heavy infections with hookworm can lead to anemia as a result of the worm's ingestion of blood. When hookworm eggs have been deposited in warm, moist soil, the non-infective feeding first stage, known as rubidiform larva, develops within 1 to 2 days and feeds on bacteria in the soil. A non-feeding infective filariform larva develops within 1 week. Humans are infected when the filiform larva penetrates the skin. The organism enters the circulation and breaks out of the capillaries into the lung and then migrate up the bronchial tree, over the epiglottis, and into the digestive tract. After additional larval molts, the worms attach to the mucosa in the small intestine. Eggs are produced within 6 to 8 weeks after skin penetration by the filariform larva. Two species of hookworm, Necator americanus, also known as New World hookworm, and Ancylostoma duodenale, known as Old World hookworm, infect humans. A. duodenale is seen in southern Europe and northern Africa along the Mediterranean, as well as in parts of Southeast Asia and South America. N. americanus has a geographic distribution in Africa, Southeast Asia, and South and Central America, and is endemic in rural areas of the southeastern United States. Adults of the two species can be differentiated by the morphology of the buccal capsule, or in the male, the copulatory bursa. The eggs, however, are identical, so the species cannot be distinguished based on their eggs. They appear disorganized with globular contents within a thin, clear, smooth, colorless shell, and measure 50 to 60 micrometers in length. When the anterior buccal capsules are examined in adult worms, the difference can be seen in N. americanus having flat tetrade cutting plates, whereas A. duodenale has 4 pointed teeth. This figure just shows an example of the hookworm egg. So here you can see that it has a disorganized globular contents and a thin, clear, smooth, colorless shell. Aside from the eggs being indistinguishable, the rubidiform larva also cannot distinguish the species, and it measures 250 to 300 micrometers long, in which small and conspicuous genital primordium may be observed, and a long buccal capsule. The adult worms, as mentioned before, are what can be distinguished to species. So the left figure shows an example of the adult worm of Ancylostoma duodenale. So here, the anterior end is depicted showing cutting teeth. So here, on this part of the image. Whereas the right image is an example of the adult worm of Necator americanus, and the anterior end instead shows mouth parts with cutting plates on either side, here and here. Figures A and B on the right show examples of the rubidiform larva of hookworm. And with these, again, you can't distinguish which species at this stage. But it's important to note the way the buccal cavity appears and the lack of genital primordium, as can be seen on the right image, denoted as hookworm, compared to the left, Strongyloides, which we'll talk about later. So it's important to note these structures to differentiate the hookworm species from Strongyloides. So Strongyloides stercoralis is known as threadworm, and it inhabits the small intestines, but it's also capable of existing as a free-living worm. It's endemic in tropical and subtropical regions, including Southeast Asia, Latin America, and sub-Saharan Africa, but it's also been found on all continents except Antarctica. Strongyloides stercoralis can persist in the host for decades after initial infection and may progress to hyperinfection if the host becomes immunocompromised. Many patients are asymptomatic, but those who do present with symptoms usually have fever, nausea, vomiting, tracheal irritation, and gastrointestinal upset. Sometimes infection can cause diarrhea, abdominal pain, coughing, and shortness of breath. Immunosuppressed patients in particular are at risk for disseminated strongyloidiasis or hyperinfection. So in this immunocompromised population, large numbers of filariform larvae develop in the intestines in an autoinfective cycle and migrate from the intestine into the lungs and other organs, such as the liver and the heart and central nervous system, causing a fatal infection. The life cycle of Strongyloides stercoralis can actually take one of three phases. Direct, which is similar to that of hookworm. Indirect, which involves a free-living phase, or autoinfection. In the direct cycle, the fertile egg hatches in the intestines and develops into the rubidiform larva, which is the non-infective form, which is then passed into the stool. In the soil, the rubidiform larva develops into a filiform larva, which are infective for humans by direct penetration. Once the larva has penetrated the skin, it enters the blood circulation, breaks out from the capillaries into the lung, and migrates up the bronchial tree over the epiglottis and enters the digestive tract when it matures into an adult worm. In the indirect life cycle, the rubidiform larvae in the soil develop into free-living males and into females that produce eggs. At any point, the free-living cycle may revert and result in production of infective filariform larvae. In most individuals, the autoinfective life cycle allows the initial infection to persist at low levels for years and is an underlying cause of hyperinfection. In this cycle, the rubidiform larvae, rather than being passed in stool, develop into the filariform larvae in the intestines. These filariform larvae then penetrate the mucosa, enter the blood cells circulation, and return to the intestines to develop into an adult. The rubidiform larvae, when observed microscopically, measure 200 to 250 micrometers in length, have a short buccal capsule, a large bulb in the esophagus, and large genital primordium. Eggs rarely, if ever, are found, and they look similar to hookworm eggs. They measure 54 by 32 micrometers and are often segmented. So here are some examples of Strongyloides stercoralis rubidiform larvae. So in figure A, you get a better view of the buccal capsule, and this is an iodine wet mount. Figure B on the right shows the short buccal capsule and the prominent genital primordium. So this figure at the bottom just gives a better depiction of the buccal capsule, the genital primordium, and then also the bulb that was described. So the next few roundworms we'll discuss are those that can be found in blood and tissue, because up to this point the roundworms we were discussing were involved in the intestinal tract. So Trichinella spiralis is a roundworm that's acquired from undercooked pork. Trichinosis is the infection that occurs of muscle tissue with the larval form of Trichinella spiralis. Two forms of larva migrans exist in humans, cutaneous and visceral, and these are as a result of the dog or cat hookworm. Toxocara species causes the visceral larva migrans form that is a result of ingestion of dog or cat roundworms. With Trichinella spiralis infection, it's difficult to recover adults or larvae in a stool specimen, so diagnosis is usually based on clinical symptoms and patient's history. Biopsy of muscle tissue and identification of encapsulated coiled larvae is the definitive diagnostic method. So this is an example of a biopsy specimen of a mussel containing larvae. The last group of worms we'll discuss are filarial worms, which are roundworms of blood and tissue found primarily in tropical areas of the world. Several species infect humans. So again, here's another table showing the scientific name of some of the organisms we'll discuss, and then here gives their description and or common name. Adult filarial worms range in size from 2 to 50 centimeters, and they live in human lymphatics, muscles, or connective tissues. Mature females produce microfilariae that are the infective stage for the insect during the insect's blood meal. Once ingested, microfilariae penetrate the insect's gut wall and develop into the infective third stage, which is the filariform larva. These larvae enter the insect proboscis and are introduced into human circulation when the insect feeds. Microfilariae are the live-born larvae that adult roundworms give birth to. Identification of the various species depends on the morphology of the microfilariae, periodicity, so the migration periods of the microfilariae, and location of the worms in the host. Important microfilarial morphologic characteristics include the presence and absence of a sheath, which is the remnant of the egg from which the larva hatched, and the presence and arrangement of nuclei in the tail. Table 2810 in your textbook compares the species of microfilariae commonly found in humans and their distinguishing features. As was described earlier, the female birth live microfilariae, which are found in the blood and lymphatics or subcutaneous tissue of infected humans. Once an insect vector bites the human and ingests the microfilariae, they develop in the insect into the infective filariform larva, which then migrate to the salivary gland, in which the insect vector can then bite another host and infect them with the larva, and the cycle continues. As can be seen in the table 2810, and will be discussed on the subsequent slides, each organism or microfilariae has a different arthropod vector associated with it. So the first filarial worm is Wuchereria bancrofti. So the vector for this parasite is the mosquito. Early symptoms of infection include fever, chills, headache, inflammation of the lymph nodes and lymphatic vessels. And of the lymphatic vessels, they're generally those located in the lower extremities and genitals. In late infections, the lymph nodes and vessels become fibrotic and edema occurs. So Wuchereria bancrofti is actually the causative agent of elephantiasis, which occurs in tropical and subtropical regions. Although this form of infection occurs in less than 10%. Wuchereria bancrofti microfilariae can be observed in peripheral blood smears, and they're encased in a sheath. These microfilariae have nuclei that do not extend into the tail, and specimens should be collected at night between 10 p.m. and 2 a.m. since these organisms are nocturnal. So this is a Giemsa stain of Wuchereria bancrofti, showing the sheathed appearance of the microfilariae and how the nuclei do not extend to the end of the tip on both sides. So here and at this end as well, as the sheath folds over and no nuclei extend there. Brugia malayi is another nocturnal microfilarial species that's found in the Far East, including Korea, China, and the Philippines. Mosquitoes have been shown to transmit Brugia species. The pathologic presentation of disease and clinical symptoms are similar to those seen with Wuchereria bancrofti infections. The main distinguishing characteristics of the microfilariae are the presence of a sheath and the arrangement of tail nuclei, since the nuclei extend to the tip, but a space separates the two terminal nuclei. Again, since Brugia malayi is nocturnal, specimens should be collected at night between 10 p.m. and 2 a.m. Infection with loa loa is transmitted by the mango or deer fly. Loa loa is also referred to as the eye worm, and it's limited to the African equatorial rainforest, where the fly vector breeds. Adult worms may live for as long as 15 years in humans, and they migrate through the subcutaneous tissue, causing temporary inflammatory reactions. These are referred to as calabar swellings. The adult worms can often also be seen as they migrate across the surface of the eye. And diagnosis can be based on the presence of the calabar swellings or of the adult worm in the conjunctiva of the eye. Microfilariae may be seen in blood specimens if taken during the day, especially around noon when migration peaks. The microfilariae are sheathed and nuclei extend to the tip of the tail. So this figure shows an example of a Giemsa stain in which, from the peripheral blood, in which you can see the nuclei extending into the tail, all the way to the tip. And again, specimens for loa loa should be collected during the daytime, typically between 10 a.m. to 12 p.m., with peaking migration at noon. Onchocerca volvulus is another microfilarial organism, and this is found in Africa and South and Central America. The vector for this species is the black fly. Symptoms of infection include nodules in the skin as a result of the adult forms, and complications can occur when they settle in ocular tissue, which can result in blindness. Onchocerca volvulus species have non-periodic migration, and laboratory diagnosis includes the skin snip method, in which a small slice of skin is obtained and placed on a saline mount to observe microfilariae. Onchocerca species microfilariae show no sheath. The nuclei also do not extend to the tip in this organism. So this is an example of a hematoxylin and eosin stain of a cross-section of tissue infected with Onchocerca volvulus. This image is a little more difficult to see, but you can see that there's no sheath on the tips of some of these organisms, and also the nuclei don't extend all the way to the end of the tip. Mancinella species are filarial worms that are not usually associated with serious infections. They're transmitted by midges, which is a type of fly. The microfilariae of Mancinella streptocerca are found in the skin, and they are unsheathed and have nuclei that extend to the end of the shepherd's crook tail. Microfilariae of Mancinella ozardi and perstans are found in blood and are unsheathed. Mancinella ozardi microfilariae have tails with nuclei that don't extend to the tips, whereas the nuclei in the tail of Mancinella perstans microfilariae extend to the tip. Dracunculus metadensis is the last roundworm that we'll discuss, and it's also known as the guinea worm. It causes serious infections in the Middle East, parts of Africa, and India. Adult worms mature in the deep connective tissue, and the females migrate to the subcutaneous tissue. Initially, a painful blister-like inflammatory papule appears on the leg in the area where the gravid female is present. The papule ulcerates when the area comes into contact with water, and the female worm then exposes her uterus through the ulceration and releases larvae into the water. Patients may experience nausea and vomiting and urticaria before the rupture of the worm's uterus. Humans acquire infection by ingesting a copepod that contains the infective larva. The larva is released in the intestine, penetrates the intestinal wall, and migrates to the body cavity in which males and females mature. Diagnosis is made from observing the typical appearance of the lesion. So this concludes our discussion of the various worms in the parasitology chapter. So since this section covered a lot of material, I just want to go through the next two slides with important points to remember. So first, with the flukes, diagnosis is made by finding eggs in a fecal specimen, but the two exceptions are Paragonymous westermanni, which would be found in the sputum because infections are associated with lungs, and Schistosoma hematobium should be found in the urine. Humans are definitive hosts for tapeworms, and animals and insects serve as the intermediate hosts. The eggs of Taenius species are identical and need to be reported as such. The diagnostic stage for roundworm may be egg or larval form depending on the species. Enterobius vermicularis, also known as pinworm, is common in children and diagnosed by the tape test prep, or by the pinworm paddle. Strongyloides stercoralis eggs are not usually present in the stool. So you're typically looking for the rhabdoform larva. Trichinella spiralis is acquired when humans ingest raw or undercooked pork containing the larval form, and diagnosis of trichinosis is made through biopsy of tissue to identify the coiled larva stage. Diagnosis of filarial worm infection is made by observing the microfilarial in blood or tissue specimens. And finally, the larval characteristics of the filarial worms include the presence or absence of the sheath and the location and arrangement of nuclei in the tail of microfilaria. And this is what helps determine and identify the different species.